I started in the ICU. As much as we're not supposed to say time management, that's really the key thing in the first 3 months is learning how to manage your time, because you will be at work charting until 10 o'clock most nights.
It's 8:30 right now.
So
We're still here. We just got in charting.
So it doesn't get better as you get. You're still here after work.
First year, it's rough. Yeah. Nursing school is a whole different lifestyle, actually, being a nurse. Mm-hmm. If I could do nursing school over again, I don't know that I would do it. Being out in practice, it's a lot different.
Always make sure you have good time management. That's your most important thing. She told me not to say that at all, but it is the most important thing. You'll get burned out if you don't have good time management. Mm-hmm.
Had I not been a CNA and worked as an ER tech at 2 hospitals, I probably would have been freaked. But I did have hospital experience, and so I think that helped me make the transition.
Everything falls back on the nurse. Mm-hmm. It's kind of your job to make sure that you protect your patient, make sure that the doctors don't kill the patients. Especially here, we're a teaching hospital, so we have a lot of young doctors.
Be afraid to go in and do something and learn new things.
Number 1, no question is a stupid question. If you get conflicting information, keep inquiring until you feel comfortable with the answer you've received. Number 2, always go with your gut feeling. It's usually right.
Yeah.
You know.
Never be afraid to ask questions. Never assume that you know anything, because you are dealing with people's lives, and it's always important to make sure that you, even if you've never done it before, it's always good to have confidence to act like you've done it before, but make sure you talk to somebody, make sure that you know what you're doing, you're doing it right before you go in there and try it on a human being.
If you don't feel comfortable with something, make sure you ask questions, because any manager you talk to will be like, make sure you ask questions, because that's when you have problems, that's when you have the incident report.
And trust your gut. Usually your gut instinct is right. That's why you became a nurse in the first place.
Breathe.
Really?
Breathe. It'll be okay. You will make it through it. You're going to have your ups and your downs, but don't be afraid to ask questions. Things change, things happen, and don't be afraid to ask questions. Don't be afraid to ask for help.
Help each other out, because sometimes it's a little overwhelming. Yeah. Be nice to everybody. Help everybody else out.
Just because you are a
be
nurse,
a team player.
Yeah, just because you are a nurse does not mean that anybody else in this hospital is not as important as you are. Yeah. Everybody is as important as you are. People from dietary,
house cleaning.
House cleaning.
You'd
be surprised if you make friends with people that you think aren't as important as you, how they can make your lives easier at work.
Yeah.
So
I thought I knew a lot.
So I remember being very nervous.
The biggest thing whenever I graduated was building confidence and learning things from school to putting it into practice and getting your niche on how to do things.
I felt like that first year, you're really learning. Mm-hmm. You're trying to learn a routine. You're trying to learn, I know they teach you things in nursing school, but it's putting everything in practice and learning how to do everything. And, you listen to long sounds, but it's really, defining what long sounds are what. And, okay, I've never heard this before, so what exactly is this? And
you're always learning. I mean, I've been a nurse for 4 years now, and I have been learning every day. You learn something new every day. You never know everything. Don't act like you know everything.
Because you don't.
You don't. I mean, there's nurses that have been here for 30 years, and they learn something new every day, too. And if you act like you know everything, you're going to make a lot of enemies really fast.
I was supposed to get 6 weeks of orientation, but they thought I was doing so well, they cut 3 weeks out.
And if you have issues with your preceptor, you just don't mesh right, make sure you notify your manager, because they will get you somebody else most of the time that is a little more on your level. Because some people's personalities just don't mix very well, and you need to be with somebody who can actually teach to your level.
I felt pretty comfortable in my skills, and I felt like anytime I was taught something new, I adapted very quickly.
Everything falls back on the nurse. Mm-hmm. It's kind of your job to make sure that you protect your patient, make sure that the doctors don't kill the patients. Especially here, we're a teaching hospital, so we have a lot of young doctors.
Most of them are super nice, and you can have a normal conversation with them, and they're nice about it. There's a few that aren't that pleasant, but it doesn't bother me as much as it did then.
Yeah.
I actually had one make me cry
Oh, no.
in my first year of being a new nurse, so, but.
Male nurses.
You're going to be abused
Yes,
for your
yes.
muscles.
Male nurses.
Buff up.
Male nurses, you should probably, if you work out, you should probably stop working out now, gain a lot of weight, because you'll be asked to move every person in the house and do everything. Like 2 seconds before we started this interview,
And shrink.
I got asked to remove a knob off of something. I mean, it just never fails. But there really isn't any boundaries anymore with male nursing. I mean, it's pretty much an equal field. Just because you're a male nurse, don't think that you're better than anybody, because
You're not.
you're not at all. And actually, you're probably a little less, because the female nurses that you work with probably have hundreds of times more experience than you do. So don't act like you know everything, and just take it all in.